A little bit earlier. Kathryn, I can't remember your name. Detroit Community Health. Thank you. She's going to be talking to all of you about food systems, the environment.
Oh, we have two attendees. I just want to make sure they can hear us. Attendees, if you can hear us, please chat into the chat box to let us know. Can you hear us okay? Oh, never mind. It says two, but
right, is it better if I stand around?
Oh no, we have JR. JR, can you text or type into the chat box to let us know if you can hear us? We are recording this, so if folks can't hear us. Can you hear us, JR? Make sure we're only going to give it like 30 more seconds. All right, I think we proceed and down.
JR from down.
None of that JR.
Down.
Okay, well, oh, I got a chat back. Ooh, great, yes, thank you, JR, you can hear us, awesome. That lets us know that our setup is working, so we're free to proceed.
Okay, thank you. Again, I want to welcome all of you. I was really excited to hear what a great, exciting, dynamic group of people are in the room. I feel like you probably know a lot of what I'm going to present to you today. But this is kind of one of the presentations that's like a mile wide and a little deep, and it's just going to touch on a whole bunch of things and kind of put a big sort of framework on both the food work that we're just thinking about, but also Friday sort of system thinking approach to all of the work, and touch on some of the other topics that you'll be hearing about in the other presentations. So I'm going to go to the next slide, which is just an overview. So we're going to talk a little bit about what is the food system, a little bit about why we focus on healthcare advocacy, and then really get into just a range of different health concerns in our industrialized food system, a little bit about how this connects to climate and energy, a little bit about plastics, a little bit about pesticides and antibiotics, because those are some of the things that we work on as an organization, and very briefly on all of this, and then a little bit about making change and how we, as healthcare advocates, can think about making change. So our work at the Ecology Center really takes a systems approach to all of our efforts, especially around our healthy food, and a lot of our thinking as a society around food and health is around individuals and what individuals can do, individual behavior. But it's also to remember that individuals are embedded within, a system of relationships involving family and community, and a larger society that influences the choices that people have and decisions they make. And that's a whole ecosystem that we live in, an environmental kind of ecosystem that influences our health and our food choices. And it's just having this broader framework not only gets us beyond thinking about individual solutions, but it gives us different avenues of thinking about how to bring about change. So I'm going to start by asking you all, what is healthy food? How do you think about when you say, what is healthy food? How do you define that? So just popcorn, you don't have to raise your hand. Just real food?
I think about how it's grown.
How it's grown.
Originated, whether it's genetically modified.
Nutrient dense.
Nutrient dense.
Unprocessed.
Effects on the environment. Free of pesticides. Free of pesticides. Right.
How you fix it, how you prepare it.
How you prepare it.
Delicious.
Delicious. I'm sitting here talking to you about food right before lunch, I make you all hungry. Okay, and fruits and vegetables, yep, it's healthy. Okay, great. So there's a lot of different ways to, say what is healthy, and I think we've touched on a lot of those. I just want to go to the next slide. That the Ecology Center uses the definition of healthy food that is, of course, the nutrient value of that food. The nutrient value is really essential. That's why we eat, but we also eat for other reasons, and also how that food is grown, as somebody said, is important, whether it has pesticides in it or not. So we said that healthy food is food that is not only highly nutritious and nutrient dense, as somebody said, it comes from a food system that is ecologically sound, economically viable, and socially responsible. So taking into account all of these aspects is really what we define as healthy food. Okay, next slide, yeah. So a food system, I've been using the word food system, so there's a lot of different ways to define it, but it's really just the entire system of all of the processes and inputs that go into creating food. It's growing and harvesting and processing, packaging, it's how that food gets transported and where it goes to, how is it marketed, who consumes it, and how is the waste disposed, both the food waste and the packaging waste. So all of this is part of what we constitute the food system. In the next slide. So it's all these inputs, but it's also the outputs, it's the crops that are generated, and it's the waste that comes along with it and how that gets disposed of. And we also can say that a food system operates within and is influenced by the social, political, and environmental context. So a food system in our society might look very different from a food system in, a hunter-gatherer society, in a different time and place. So a food system, another way of saying that is that a food system reflects the values of the society in which it exists. So for example, in our society, the people who work in our fields and pick our food are some of the most poorly paid and poorly treated individuals in our society. And that is a reflection of things that we value or don't value in society. And so people who are exposed to pesticides as farm workers and children who are laboring because they're excluded from farm labor protection, laws as farm laborers, that's a reflection of our society, that's part of our food system. So it goes beyond just the food itself and just kind of put it in this context. And, again, the human resources, the labor that people who do research and education around food, this is all part of our food system. So we're defining it very broadly. A lot of times you see food system illustrated as a diagram. It's a whole variety of it, and I think Lindsay's really fond of collecting different diagrams. So there's different ways of illustrating what a food system might just interesting. I like them too. I kind of like this because I think it's kind of fun. And showing eating apples, which speakers in our presentation later. So it's a little hard to read here, but this is exchange. This is trade and commerce at the center. The resources, the land, the water, people, the money, the seeds that go into planting, producing, processing, eating, and then waste. And you see all the different forms of transportation. So it's just one way of illustrating. There's a lot of different ways to that's done. So a lot of times I think in our society, when we think about food, we have this sort of romantic notion about where food comes from. It's, it's the farmer with the hoe and the overalls. They're out there in the field, and they've got chickens running around and their cows, and that's the image that we have because that's where we as a society come from. That in this country, in 1870, 90% of the population lived on farms. Today, it's 2%, and only 1% of the population actually makes their living as their primary occupation being farming. So we've really made a radical transformation, and yet I think our notions about what farming is are still there in our heads. But it's somebody out there in the field. Next slide. Again, the chickens, crops. You're close to the earth. Yeah. Hands in the dirt. That's my brother. This is my twin brother. He's a naturally grown, certified farmer in Northwest Georgia, and that's his farm that was owned by his family, who homesteaded it since the 1870s. So just an example is but this is the exception. But I think this is the mentality that we have and the thinking when we think about farming. Okay, the reality is most of our farms look something like this. From the 1870s, the average farm went from being very small. In the 1940s, the average farm was 149 acres. And currently, the average farm is around 400 acres, with commercial farms being around 1,600 on average. So we've gone from small family farm to large industrial agriculture, really in the context of a single generation or two. And so this is a real radical transformation that has implications not only for what we eat, how we eat, but how healthy we are as a society and how healthy our environment is. and this is just another example. Industrial, what we call conventional farming is actually industrial farming based on the factory model of producing the maximum amount of product in, with the least amount of dollars. What we call conventional or industrial food systems tend to be very large scale and monoculture, and they use a lot of fossil fuels, contributing to climate change, and use a lot of industrial machinery. And one of the really key things about this is that it separates animal production from plant production. You saw that first slide was the wheat and the acres and acres, totally separate from the large scale, agricultural farm with the livestock. And the problem with that is that it separates that waste that doesn't then get recycled in. And you have, livestock producing massive amounts of waste that gets dumped someplace, and then you have a lot of waste from the plant production, and they don't tend to be integrated into a cycle the way they were originally on small family farms. And then you get a lot of processed food. Somebody mentioned processed food, pesticides and synthetic fertilizers. And so what we've got is a system that is really good at producing a lot of very high calorie and low density nutrition products. This is one of the major drivers of our problems with obesity, cancer, malnutrition, and problems that we have as a result of eating slow food. Next slide. So what we're trying to do is promote healthier, more alternative food systems that are healthier not only for the people who work and growing the food, the people who consume the food, but the people who are all part of the system all along the way. And one example that I like to point to are our friends at Avalon International Bread in Detroit, and they've got a store here in Ann Arbor now. And their slogan is "Eat Well, Do Good," but it's focusing on its triple bottom line of earth, community, and employees. So, and healthcare advocacy, we like to focus on working with healthcare advocates because you all are in the front lines of seeing, we have sort of this, what we call a broken food system, and people who are in healthcare and the healthcare industry is really at the forefront of dealing with the burden that is created by that, whether it's people coming with obesity and chronic illness, or diseases from being exposed to pesticides in our food. So, that's why it's really important. And also because healthcare providers have a really powerful voice in our society and can be really powerful agents for change. Next slide. And a great example and model for this is the anti-smoking campaign, where this is a big societal problem that was causing health concerns, and the healthcare industry was really pivotal in stepping up and advocating in multiple ways and different kinds of intervention, from changing regulation around secondhand smoke to changing the environment in hospitals and changing the rules around advertising so that the change that came about, where now it is considered the exception, to be consider yourself a healthy person and smoke, whereas a couple of generations ago that was kind of the norm. All right, so we're going to look at what are some of the concerns about this industrial food system. Next slide. Before we do that, go ahead. Before we do, we're going to look at apples. It's an example of a food system. I'm going to pass around a little chart. So this is an example, and while you pass that around, I'm going to share some fun facts about apples. So apples in Michigan. Michigan is the third largest grower of apples in the nation. So, so this is a really important crop in our food system here in our state. And we have more than 20 different commercial varieties that are grown with an average of $700 to $900 million impact to our economy. So this is a major part of our agricultural economy. It's one of our most valuable fruit crops. And most of the apples that are grown here in Michigan are processed. They're made into pie filling, or applesauce, or jellies, or cider, or juice, or vinegar. And we're also the leading producer of commercially prepared apple pie. So that's just some fun facts about apples. So what I want to do is just to take this idea of a food system and the sort of different ideas of the different components of a food system, and think about what are the environmental health impacts that we can think of in these different areas. So we've got the little chart here. What I want to do is after each table, I'm going to try and use it growing and harvesting and packaging and processing and consuming and disposing. And 2 minutes, talk with the person at your table and talk about what are the ways in which there are environmental health impacts at that particular point in the food system for apples. And then we'll share. All right. I know that's short, but hope you had a moment to get everybody's attention and call you back. Yeah, gather back together in the group. Great. I know that was short, but so hopefully you had a chance to talk and come up with at least. So what I would like to do is just have each table share one thing. And say what your part of the food chain was, and for apples, and what your one idea about environmental health impacts are.
So we were talking about growing, and so we were talking about the trees and how, you know, if there's a...
Speak up.
We were talking about growing the apples, and so we were talking about the environmental impact if you have huge orchards of the apples, and what it does to the nutrients in the soil. And we were talking about how the pesticides that are applied to the trees to keep them up, right? So those were the two big ones.
Great. Thank you. Yeah, those are go ahead.
So we talked about fossil fuel use, especially in a more industrial setting with just a large area to cover. There's probably a lot of fossil fuel use with that, and then possible exposure to different chemicals to the workers as they're doing the harvesting.
Thank you.
Okay, so we had packaging. We talked about how many times they're packaged in plastic, and that the plastics sometimes are colored based on the apple. And the packaging doesn't tell us which one is the most nutriently dense. And then how the push for those apples usually does not occur until the fall. So that's not that consistency of having these nutrients year round.
Okay. You know that?
We had disposing a little bit.
Oh, well, let's go there.
We had processing, so lots of nutritional value, lots of fiber, lots of vitamins, at the same time additives like sugar and generating waste.
So we had three main points. Energy usage based on like how we're cooking or preparing it, length of holding, and our storage methods, as well as purchasing power, because that ultimately supports businesses that have a greater environmental impact.
And you first dispose of.
So we just said there's probably a fewer amount of people composting than just throwing away. So when that goes into the landfill, thinking about not only just the core of an apple, but the packaging that's coming in, whether that's applesauce or cans or whatnot. So.
Great. So you can see that, food systems are complex, and there's a lot of different places all along the system where there are ways that it can impact the environment and our health. So you guys are probably just already getting my presentation for me. So, like I said, I'm not going to go too deeply into any of this. There's a little, we just went through that. Next slide. So these are some of the key health concerns with our industrialized food system. We kind of alluded to most of these already, but exposure to toxic chemicals. You know, somebody mentioned plastics. So the pesticides that are used in production, but the plastics that are used in packaging very frequently contain phthalates, and our healthy food folks will be talking more about plastics and phthalates when they get to the toxic section. But that's something that there's chemical exposure there. Antibiotic resistance, we're going to touch a little bit on that. That the routine use of antibiotics in animal agriculture has become a problem, you know, not only within the agricultural system, but within the healthcare system as well. Genetically modified organisms, somebody mentioned earlier, so that's, you know, another concern where we're being exposed to organisms and varieties that are being created that we don't know the full impacts of that on our health. Environmental degradation of all kinds, so the water from exposure to pesticides and fertilizers, and air pollution that comes from machinery and other kinds of, or even from pesticides that get blown across fields and into communities. So there's a lot of different ways in which our land, air, and water are degraded. And somebody mentioned just having a big orchard or having big expanses where you used to have more biodiversity, that has impacts on the health of the ecosystem, and it also can lead to erosion, and which impacts the water quality and land quality for future agriculture production. And then the consumption patterns we talked about leading to, you know, eating food that is highly processed leads to, you know, problems for our health. Okay, next slide. And so we talked about with apples, but just in general, there's different places in the food system where we see certain kinds of problems. In production, we see the problem with pesticides, antibiotics, and hormone use in meat and dairy products, infection agents, and arsenic, which is used in various crops. In processing, there's a problem with a lot of different things there, but foodborne illness is a key one in the processing. And there's been increased problems in the last years we've seen with different infectious diseases that have been caused by processing plants or places where agriculture is happening on large scale next to animal agriculture, and the bacteria cause infectious disease. And this, with our food systems working in a way that is very global and widespread, we're not getting farms, you know, food from a farm that's right next to us, where we know exactly what's going on. But in many cases, if that infectious illnesses in the food, that it can be very widely distributed because, you know, the spinach that was grown that was infected with E. coli goes to thousands of stores all across the country, and it can take a long time to track down where did that food come from and actually track back to, you know, making sure that everybody is safe. Packaging, we mentioned phthalates, but bisphenol A, which is used in the lining of cans. That's one of the things Ecological has been testing recently, and testing alternatives to as well. Is something that is part of packaging as well as the plastics. And transportation, you know, there's the air quality impacts that come from widespread transportation. The average piece of produce travels 1,500 miles from the point that it is grown to the point that it is consumed. And so that's a lot of air pollution. When you think approximately, you know, a mile equals about one pound of carbon dioxide pollution. So it's contributing to climate change as well as the particulate matter pollution that comes from trucking. And then we have lots of packaging that ends up getting sent to waste landfills or to incinerators, as we have in Detroit, and that's a problem for health. And consumption, you know, we talked about fast food, sugar-sweetened beverages, and things like high fructose corn syrup that can be, and some of the pesticides even can be considered as obesogens and contribute to the obesity problem in and of themselves. Okay, next slide. Oh, I just moved my plastic slide. Oh, good. Oh, there it is. Okay, that's it. So I'm going to throw this in And I bring this in because I just went to a conference about plastics with people from all over the world talking about plastics and how we get out of this plastic system. And I think it's really interesting because it connects the food system to the toxics, to climate and energy issues, and waste issues as well. So this is just a map that has been created of what our plastic food system looks like, and it's really interesting because it does connect to all of these issues. If you start with extraction, right now, plastic used to primarily rely on petroleum as feedstock to make plastics, and now it is mostly natural gas, which is really cheap, which is driving a real push towards natural gas across the state for energy, but also for plastic production. So you have extraction, which is called fracking in a lot of places. You've probably heard of fracking, which is very damaging to water quality. And the fracking, oh, thank you, get a little pointer there. And then and that of course contributes to climate change and water impacts. And then the natural gas either goes to a plant where it is burned for energy, or it goes to a chemical and plastics production. And increasingly, this is infrastructure that's being very, very rapidly built out, especially across the Pennsylvania, Ohio Valley and the Gulf Coast of the United States. 264 new plants are expected to be expanded or built in the next 5 years in those areas to take natural gas and turn it into plastics. And then that plastics, of course, which is very, very toxic, production, these facilities are really horrible. They just came from Houston, where I saw a whole bunch of them. And then that is created into plastic products that get sold, in your cups at Starbucks, or products that are, your apples that are wrapped in plastic, or your individual cabbages in the stores these days are wrapped in plastic. And then all of that goes to the waste management. Although a great deal of it now ends up in the ocean, and you're probably hearing something about that. So this kind of connects all of the waste, toxic, climate change, energy, and food issues, because so much of that plastic is single-use, no post-consumer value products that therefore are ending up in our oceans and landfills. And, we all know what they are. So, straws and cups and all kinds of little plastic things that we use and have a great role in our food system in particular. So I just want to throw that in because just learning a lot about it, I think it's really a connector of all of this. Okay, so I'm going to just look next slide, a little bit about climate change. So climate change isn't the first thing that we think about when we think about our food system most of the time, but it's really important, and it's becoming an increasingly urgent one when we think about the public health impacts. There's a great variation by climate. No, go back. Oh, yes, that's sorry. Yeah, the plastic one was actually. Approximately 1/3 of all the human-caused greenhouse gases emissions that are driving our climate change come from agriculture. And so our agriculture system is a big part of, and that's because it's driven by fossil fuels. And that is leading to, climate change is leading to increased droughts. This is a picture of a Michigan farmer a couple of years ago, I think it was about 2014, where there was a big drought. And also flooding, which we're seeing, even here in Southeast Michigan. And with that comes increased challenges with the production and distribution of food, and changes, and not only in food availability, but in food prices, which has already been seen in some parts of the world and is more likely to be a concern in the future. And climate change is really expected to increase food insecurity, not only in the developing world, but in developed countries as well. And I think it's really important for health folks to be aware of climate change as an impact, because it will begin, if we don't change the ways that we create energy and use energy in our society, it's going to change our impact in our healthcare system. We will begin to see a whole range of impacts, not just from food. Okay, and there'll be more about climate and energy in another presentation. So just a few words about pesticides in our food production. We've mentioned this already. It's something that is, very widespread in use, although pesticides are used in many different sites. We use them in our home, we use them in our workplaces, they are used in parks, they're widespread in our society. 75% of pesticide use in this country is in agriculture. A pesticide is any substance that is used to prevent, destroy, or repel pests, and pests can be anything from weeds to rodents. And so I think it's important to think about that because, you know, as a society, I think we have this attitude where pesticides, like, there's a roach, kill it, you know, if it gets the raid, right? At least that's what my family gets the raid. And you know, that these are chemicals that are designed, you know, by design intended to kill living things. And so therefore they have impacts that can be harmful to the health of us and to other living things. So there's a whole range of pesticides out there. There's 16,000 pesticides that are for use in the United States, both agricultural and non-agricultural, and they come in a whole bunch of different categories. I'm not going to go into details about them, but each of these categories is a different sort of class of chemicals and has different impacts on human health, different ways of, you know, times of persisting in the environment or breaking down in the environment, and so they each have different kinds of impacts. The other thing is that we don't have a lot of good information about most of those 16,000 chemicals that are out there in use. We know something about a lot of them, but we don't know, you know, a lot about a wide range of chemicals that are out there. But there are known health concerns from pesticide use, and it depends again on the type of pesticide and whether that exposure is acute or chronic. But there's a range of nervous system, eye and skin irritants, hormone and endocrine system problems. Many pesticides are what we consider endocrine mimics. They mimic the structure and function of endocrine chemicals in the body and therefore can be disruptive. Many are known carcinogens or suspected carcinogens, and as I mentioned before, a lot of them are obesogens as well, and linked to increase in BMI and insulin resistance. So this is just a quick map to show you pesticide use, and the darker the color, the more pesticide use. So you can see that our major industrial states of Florida, largest industrial, agricultural states, Florida and California, light up on the map, you know, with the highest levels of pesticide use. Next slide. And this is a map of the Great Lakes. It's a little dated, but you can still see the pattern, which is that there's a lot of agriculture around here. You can see over here into lower Ontario, where there's a large agricultural area as well. There's very, very heavy pesticide use, and of course, right on our Great Lakes, where there's impacts on our water quality. And again, I mentioned, you know, impacts on farm workers are some of the most extreme in our food system. Pesticide use is very harmful to folks who are working most closely with it. They can get into the air, the water, the food of all of us, but agricultural workers are most directly impacted. And there was a study in 2001 of cancer among 146,000 California Hispanic farm workers, and compared to the general Hispanic population, the farm worker population was found to have certain types of cancer, including leukemia, stomach cancer, cervical cancer, and uterine cancer, up to 60 to 70 times higher than the other population. So this is directly a result of working in the field. And it's, again, important to note that agricultural workers are specifically excluded from protections in our Labor Relations Act and the Fair Labor Standards Act. So they don't get the same protections even though they're the most exposed. And so they are most at risk for exposure to the harmful chemicals, but also for accidents and other injuries in their workplace in the field. So pesticides are also really harmful to important pollinators for our agricultural system. Bees are pollinators for about 1/3 of all the crops that are important agricultural crops. And there's been a really dramatic decline of bees in recent years because of, in particular, it's thought to be a result of widespread use of neonicotinoid pesticides, which are used in a lot of different crops. And the good news is that There is actually studies from Europe where some of these chemicals have been banned. 3 neonicotinoid pesticides were banned in 2013 by the European Commission, and the bee population there has increased and sort of resurged as a result. So the good news is that we take these things out of the system can easily recover. The bad news is that most of those pesticides are still legal for use and widespread use in the United States. So we have some work that we can do. So I want to just shift gears here for a few minutes and talk about antibiotics. In agriculture, as I mentioned, these are used in animal agriculture. And I just want to put it in the context that this is a study from the Centers for Disease Control on antibiotic resistant threats in the United States, 2013, and they said that simply using antibiotics creates resistance. These drugs should only be used to treat infections. Unfortunately, next slide, that is not the case. Most drugs, antibiotic drugs in this country go for use, 75% go for use in animal agriculture. Only 25% are used for treating human disease. So these are the same antibiotics, the same medically important antibiotics that are being used in animal agriculture, and that is fueling the resistance that we're seeing. So the next slide, yeah, go ahead. And that's just, this is just a graphic that shows how that happens, that we have antibiotic resistance because antibiotics are being used in agriculture, and then people eat them, and the antibiotic resistant bacteria pass through the meat that we eat, and then people go to the hospital, and it gets through that system. So it's kind of these two sort of circles where resistance is developing from use in hospitals and the healthcare system, but it's also being developed through the livestock, and they're kind of sort of overlapping circles that continue to increase resistance. And the Centers for Disease Control also concluded that if we're not careful, we are going to be entering a post-antibiotic era. In fact, we may already be there. If you look at the next slide, you see some figures for, this is for 2013 figures, 23,000 deaths per year can be attributed to antibiotic resistance already. And this is a growing threat, and if you look at the next slide, expected by 2050 if we don't reverse this trend, which the good news is that it's going in a good direction. And Lindsay is one of the people who's working with healthcare on this concern to try and reverse this, that this will be a much bigger problem than it already is in this country and globally. And Centers for Disease Control also concluded that the most effective way to address antibiotic resistance is to get it out of animal agriculture, because it's the largest use, and it's being used there not for therapeutic treatment of disease, but for increasing the growth of animals to be sold for profit, you know. And so there's a different way, to do this. All right, I'm going to switch gears here just again and touch on. So we've talked a little bit about, you know, kind of the overall food system, and I want to focus in a little bit on some of the health concerns that address children and pregnant women. So, you know, food is really important to all of us, but the kind of food we eat and how we eat is especially important to developing fetus, to young children, and to pregnant women because of their particular vulnerabilities. You know, we know that environmental exposures have different impacts at different points in development of a child, and so young children are more vulnerable. And the timing of those exposures, if you're exposed to a pesticide, you know, at a particular point in development of a fetus, it's going to be more or less harmful depending on where you are in development. So the exact timing matters as well. The other thing is that not only are children more vulnerable, but we are being exposed to more and more chemicals as a society because we have all these things in our food system as well as, you know, in the broader environment. And children being born now, studies show that the umbilical cord blood has up to 200 toxic chemicals that can be measured in a child's blood upon birth. So this is something something that's real. It's in all of us, and you know, that's the work that we do, is to try to raise awareness about this and to kind of push back to get some of these toxic things out of our environment. So next slide. And when we think about children and food system, we often think about it like this: with a young child eating, you know, their first like solid food, but we often don't think about what comes before that. And I want to just emphasize that in order to really understand our food system, the next slide, you know, thinking of how we can integrate the best first food for all babies and how we protect that from environmental harm is also important. Because both breast milk and formula can be exposed to environmental toxins. A lot of pesticides, for example, are fat soluble and concentrate in breast milk and in our environment. And, you know, we think that part of creating a healthy, sustainable food system is making sure that's for everybody, not just people, not kids that are old enough to eat solid food. Next slide. And also just to say about breast milk substitutes, which are called infant formula, but they're very widespread in use, but in some ways were designed to be an alternative for women, you know, the small percent of women who are really actually unable to breastfeed, but have become very, very widespread in use. So they're no longer sort of the alternative, they're the norm, and there's a problem with that because they are a product of our industrial food system. They are, you know, cultivated mostly from soy and wheat and industrially grown dairy, and then processed and put in a can and marketed heavily and put on the shelf. And you know, it's sort of an example of all that is wrong with our food system, that there's a perfect alternative out there, and we've created something that is not only not as good nutritionally, but is equally susceptible to the harms of our food system. And you know, it also uses massive amounts of water, massive amounts of fossil fuel, and in fact, there was a study on climate change that or conference on climate change where folks were advocating for promoting breastfeeding as a way to cut down on the environmental impacts, because the impacts of and water usage in particular are so a huge contributor to climate change and on a global scale. Next, so I just want to end with a few thoughts about some of the sort of systemic things that are happening. So we mentioned that, you know, a lot of us think about individual choices as choosing healthy food and, you know, eating the right thing, but we live in this system that is much bigger than us, and there's these systemic drivers. And advertising is one of those things. So this is from 1998, so it's a little data, but you can see even then, $30 billion per year, twice the amount needed to provide health and nutrition for everyone in the world were spent on advertising, and then about half of that budget is spent targeting young children to get them to eat food that is far less healthy than other stuff that is out there that's really sustainable, locally, healthily grown. Next slide. So there are many ways that we can think about addressing this from a healthcare perspective. This is from the Centers for Disease Control, sort of like looking at a pyramid of our impact. And a lot of our thinking about healthy food falls up here. It's like eat healthy, be active. It's the counseling and sort of clinical interventions, where it's a lot of effort for a smaller number of people who are impacted, and that changing the context, the things that make our system healthier so that everybody's default choice is a healthier one, you know, is where we can have the greatest impact, is focusing down here, as well as addressing things like poverty and inequality and the social economic factors that set the context for how people eat. And addressing this is where we're going to have the largest and longest lasting impact. Next slide. And then also in terms of the big picture, externalities are a factor where the health and environmental costs of our food system are not reflected in the cost of our food. You know, they are paid for by individuals through the impact on their health and their cost of their health care, and the quality of our air and the degradation of our land and our water. And so, you know, just thinking about that as sort of a big picture thing that we want to change. Okay, so this is a little scary, and I know that's kind of the point. So this is from, let me get the name of the organization here. From the, United Health Group, a major U.S. insurance company funded MIT collaborative initiatives and Columbia Urban Design to take a systems approach to look at the obesity epidemic. They wanted them to do a systems analysis, and this is what they came up with. So I know you can't read any of this, so I'm going to tell you the important part. The important part here is food and farm bill. And that drives the price of corn and wheat and cotton and soy, and the outcome is obesity. So that's the important part of this slide, is that all of this many, many complicated factors that lead to obesity are driven top down by our policy, our current policy on food and farm bill. And so, that's, that we need to think about healthy policies that change that. There's going to be an opportunity. I think the farm bill ends at the end of this year. Is that correct?
Yeah, we're in a process of updating it this year.
Yeah. So there's activism going on right now around the farm bill to change and make it healthier. That's one of the things that we advocate for, because setting those policies that subsidize all of those things that, like the corn that gets made into high fructose corn syrup that then gets integrated into all of these other things. Whereas healthy food is not subsidized. Healthy food is considered specialty crops, and these large commodity crops, they get integrated into everything, and they're making us unhealthy, and processed foods are what's driving, one of the major factors driving this whole. So, next slide. Okay, so again, it's just about taking a systems perspective. Yes, of course, we can individually make choices to eat donuts and McDonald's and drink soda pop, but there are things beyond our individual decisions that are driving those choices and the options that are available to us, and thinking about how do we change the policy that leads to better outcomes and better, healthier food being the alternative for most people. So I'm going to end with this quote from Dr. Malinga, who is an advocate for healthy food and food systems. Our national obesity epidemic is but a single symptom of a more serious illness, our unhealthy food system. In order to prescribe healthier food, we must rethink the entire food system from the farm to our children's mouths. And I think we could expand that to all of, not just the obesity epidemics, but all of the environmental and health impacts that we talked about, is really rethinking the whole system. And so that's what we try to do, and we're going to talk a little bit more about how we all can be a part of that. So I think I've taken up a little more time than I intended, but I have a few slides about what healthcare can do, but I'm going to stop first if you have any questions.
And if you have a question, please speak up so the webinar participants can hear you. And webinar participants, please use the questions tray. If you have questions, you can type those in there.
Yeah, so when you were talking, you just talked briefly about alternative food systems and in terms of triple bottom line. What if maybe you can talk a little bit about alternative food systems, or maybe it's the next part, but like I've heard this concept triple bottom line. I wonder if maybe you can explain it.
So I'm not an expert on this, but I know that it's really about accounting for the environmental impacts and the social impacts, as well as sort of the business end of it, so it's not just like how much money are we making, but it's like, are our employees treated well, are we contributing to the community, are we looking at our environmental impact? So that's, when people say they're thinking of triple bottom line, they're looking at sort of that social, in addition to sort of the financial bottom line, they're looking at some other aspects of it, so the social impacts. And I guess different businesses define it differently. Like Avalon defines it as earth, community, and employees. And I think that other businesses will define it as sort of their economic bottom line, their environmental bottom line, and sort of the social factors. So it really depends on the business, but that sort of triple bottom line is something that people talk about a lot. And so yeah, that's what we're trying to advocate is thinking about a food system that is healthier for the environment, that is healthier for the people who work in the fields and who work in the and we're going to pick up some examples of ways that people are doing that within healthcare and share them. Yeah.
So first of all, thank you so much for presenting. So I guess just one more question on your approaching the system. I think people really create that culture that seems really restricted, and there's a lot of conflicts between stakeholders and trying to approach like these system changes. So I don't know if you have any approaches you've been successful or things that you would try to do to engage more stakeholders from different perspectives as well.
So that's a big question. Maybe that's something that we could, I don't know if we would be.
Yeah, that's a really good question. After this, I will share with you guys a link to our recently released healthcare outcome playbook for how healthcare and community food system initiatives can work together. We released with that, I think, 4 case studies, and we have several more coming, and the ones that are coming later are actually 2 from Michigan. So there are a lot of examples of how people are taking those systems approach and collaborating, and that's actually a key theme of the fellowship, is that we will be throughout providing you examples. But we actually have one right here in the room, and that's Trevor the farmer at
Pull up the slide. We don't see the greenhouse there.
Oh yeah, oh, do you have that picture?
Yeah. Go, keep going.
Cool.
So this was just the last few slides were about making change. So there's different ways that you can do this at all different levels, whether it's in your particular practice, if you're seeing clients, it can be in your institution, communities, at all kinds of different levels to engage here. Go ahead next, and I'm just going to show a few examples.
Bronson.
That was your Bronson, yeah. And this is just an example of being aware, like, for example, there's a pesticide dirty dozen and a clean 15. So you can have a list like this that you can share with people. If you can't afford to buy organic, you can know that these are the ones that are the most, these are the least pesticide laden. So if you can't afford to buy organic, at least let's focus on buying these vegetables so I'm getting less exposure. There's ways that you can use this information to protect yourself without, go ahead. I'm just going to we can get all these slides, and that's available online. Yeah, if you Google.
It's from
dirty dozen. Next slide. I'm going to just go to the picture.
Yep, there you go.
Okay, so go ahead and skip this. There's some things here. We can share all this with you.
Sorry.
Go ahead.
Oh,
I'm going to go to the slide. The greenhouse. So educating your
here
we go. Healthcare farming. So this is the greenhouse, and I'll let you, Trevor, talk about it. And that's the one at St. Joe's.
Can we talk about what you do?
Sure.
Yeah.
So my predecessor, Michelle Lutz, is in there, but this is a 1,500 square foot greenhouse where we do education in there. It's not necessarily designed for production. Our leverage point is educating people around preventative healthcare topics. In fact, if you're in the greenhouse, you can look at all of our patient rooms. So we grow, not certified, but organically, using organic principles of practice, using hydroponics, and all of our vegetables go right into our kitchen. And then our kitchen will make it into soups and stocks. And much like probably the farm at St. Joe's, at St. Joe's Kitchen, we don't have any deep fryers. We do all of our cooking via prep cooking. So if we need broccoli, we get in heads of broccoli and we chop it. If we need corn, we're getting in ears of corn and we're decobbing it. So we have a fresh mentality around what we're cooking. We make all of our soup stocks. And so the system that's right in the front, the NFT system, in the summertime, I'll grow basil in it, and then we'll make that into pesto, and then I'll sell that at Henry's Market on Main, which is a Michigan produce market that I run on Main Street from June to November. So just adds that farmer's story to what's happening at Henry Ford, of a value-added product that's grown, processed, and sold right in our hospital.
And if you haven't been there, the food is great. I had the opportunity to go there, and I actually had a sister-in-law who lives nearby, and she goes there just to eat because the cafeteria.
The hospital is designed to be a community center, so people come there and just play mahjong and have lunch, not necessarily get poked with needles. And it's, when you walk in, it's a really attractive place to be.
Greenhouse right behind.
Behind, yeah, it takes a minute to get there. Yeah, I got to walk to the hospital to find it.
But you can walk through the hospital. You can walk through the, yeah, you can find it. Okay, go ahead, go to the next one. We're just gonna wrap up here. So, yeah, mentioned farmers market, this is the Eastern Market Farm Stand at DMC. Next slide, that's the, fruit and vegetable prescription program is another example of this. The Ecology Center helped establish the fresh prescription program within partnership with Eastern Market, Chad's Clinic, which is here. That's their farmers market, where the providers were writing prescriptions for fruits and vegetables to their patients, and then they would fulfill their prescription at the market stand at the on-site.
I put a plug in just to say that I think we were the second of these kinds of programs in the state.
Yeah.
And now, Michigan Farmers Market Association just published a report, and I'm not 100% sure what the numbers are, but I mean, this concept has exploded, and we, along with Washtenaw Health Department, really helped model this and support it. So it's just,
Washtenaw County was first, and we modeled our program on theirs, and now they're all over the state.
Exciting.
So there's some examples of, there's a national program called the Wave, and then Washtenaw County's program, and our program is fresh prescription. And also just thinking about how you engage and make change in your community. Almost every community now has a food policy council that is looking at their food system and trying to create better policies. And there's a lot of farm to school efforts. There's corner store conversations in a lot of urban areas about how to get healthier, fresh food in corner stores. A lot of community gardening, and then thinking about electing community leaders and officials who understand and care about our food system. So there's a lot of different ways that we can work together to make change outside of healthcare. Next. And then I said you can get involved at all levels, and you can do that in your local institution, in your local community, but then also organizations that are working nationally. Ecology Center, there's the Safer Chemicals, Healthy Families, working to keep toxics out of our foods. Healthcare Without Harm was mentioned, and they're an international organization working on reducing the impact of healthcare on the environment in a whole range of areas, including food systems. And then the National Sustainable Agriculture Coalition is another national organization working on this as well. So there's a lot of different ways, and we would love to find ways to plug you in, not only to our own work, but to other things that make sense for you. And so that's all we have for today. And so, and if you're hungry now, there's apples. They're Michigan grown, but we're going to have lunch soon. If there's any questions, maybe.
Are there any questions from folks on the webinar? Don't be shy. You can type them in anytime, and we'll get them to Kathryn or me later if you don't have any.
Lindsay, I wonder if it makes sense for you to talk about some of the things that will be happening this year in the program.
Yeah, that's great. We'll keep it recording. So this year, I mentioned the playbook, and we'll make sure you all get a link to that. It's an online resource. So we're promoting that. The primary target is the staff at hospitals who are working on under the umbrella of community benefit, which is so all nonprofit hospitals have to maintain a certain level of community benefit. They have to use dollars and staff time towards that to maintain their status. And with the changes in the American, the Affordable Care Act, the ACA, how they use those dollars shifted from covering the underinsured to being a little bit more freed up to invest time and money in sort of the more upstream challenges that we see. And so a lot of hospitals around the country are investing in community food system initiatives as a way to, to look at those upstream things that Kathryn talked about, preventing some of the obesity and other diet-related disease issues, and to improve community wellness overall. There was a quick slide that we passed over where Kathryn was referring to healthcare institutions as anchor institutions, and that's kind of the approach we're hoping to foster, and that hospitals increasingly and health systems are increasingly seeing themselves as. Henry Ford is a great example at multiple sites, including Trevor's. So this year we're going to be working on spreading the word about that playbook. It offers a lot of guidance and resources that are all evidence-based. We are part of this, our positioning is part of Healthcare Without Harm, the network, and we're organizers for them. We participated in a nationwide study, and the development of the toolkit kind of came from that. So we're offering, we'll be doing a roundtable, most likely in Detroit in June. So we'll make sure you all know about that. And the roundtable will be to bring together health systems and community food initiatives. Maybe some that are already working together and some maybe that haven't met each other yet, to try to foster some of those connections. And that's like the thrust of our work this year. I'm also working with the Open Food Policy Council on helping them identify some priorities. There's a lot of health, it's housed right now in the health department, so it's an interesting approach to, like Kathryn said, to forming a food policy council. So, and Trevor, sorry. Yeah, Trevor's part of that as well. So let me think. We also will probably do some Farm Bill education this year. We've been doing a little bit of like Farm Bill 101 plus Advocacy 101 at some of the food system events. Recently, because this is a Farm Bill year, it's important for folks just to know what it is and to know where to kind of be alert to those action items when those are coming out. So we have planned to do a Farm Bill webinar. I did hear, I haven't had a chance to update my colleagues about this. I did hear a rumor that there may be some action in April, so we might want to move our webinar up. We were originally thinking about it for fall, but one way or the other, if you have questions about the Farm Bill, you can just ask me. And I can let you know. Kathryn mentioned the Sustainable Agriculture Coalition. Before I worked here, I worked for them doing some organizing here in Michigan. So I'm pretty familiar with it, and I'm familiar with folks around the state who are working on it. And then if you also, I just want to also add, if you are looking for your food policy council in your region, I can help you find that too. There's a map, and there's pretty much one everywhere. And they would love to have you. I think that's the bulk of it. Any questions? We're also working on just, sharing information about antibiotics and local food procurement. We are hoping to launch with the Michigan Health and Hospital Association, the Green Healthcare Committee this year, a local food promotion called Michigan on the Menu, where we're trying to get hospitals just to commit to buying one or featuring one Michigan food per month on their menu. A lot of them already do that. We're just trying to capture it and promote it. Any questions about any of that stuff?
I have a question.
Yeah.
Going back to that slide on the antibiotics, the deaths that you can kind of attribute to that, do all hospitals have to report that, or was that the result of a study?
That was, I don't know the answer to that question. The data comes from the Center for Disease Control Study on the Antibiotic Resistance, but I don't know the methodology by which they did that. Yeah, it was a pretty good slide. I think it's
Yeah. This one. Yeah.
It's only 23,000 deaths. That's hardly.
There's, we should look up that source. I'm sure the source has the methodology in it.
Mm-hmm.
And answer to that is just as the way it's collected, because they have to identify here in the hospital what is your cause of death.
Right.
If you died of sepsis, and for example, the drug vancomycin, if it's on board with a therapeutic for the disease entity, it didn't work, and the patient still dies, that's a good indication of resistance. So they have to report out that data, and how it's reported out, like you said, may differ in terms of how CDC collects it.
Thank you, yeah. Any other questions? I don't see any from the webinar.
Okay.
Should we?
So we have a little bit of extra time built in today. Some of our presentations will go a little bit longer or shorter. Lunch is on the way. So we're going to pause the webinar until, I believe lunch is over at 1:30. We'll check that. So
Record now.
excellent.